Will take up the Republican fight to dismantle Obamacare. President Trump and Republican leaders claiming victory late last week after the House narrowly approved a health care bill. But it now faces uncertainty in the Senate. Senate Republicans are expected to write their own bill. I'm joined right now by House Majority Whip, Congressman Steve Scalise. Congressman, always a pleasure to see you. Thanks so much for joining us.
Good morning, Maria. Good to be back with you.
Congratulations on this historic win last week for the House. What are you expecting as it now heads to the Senate?
Well, as you said, the senators have been having their own task force put together. I talked to the Senate Majority Whip, John Cornyn, and they're focused on doing the things they've got to do to pass the bill out of their chamber. And look, what we sent them is a really good bill that focuses on some main important points. One is lowering premiums for families that are struggling under Obamacare. Another is to let people actually have control of their own health care decisions. And we made extra care with multiple layers of protection that people with pre-existing conditions are protected. And I just want to make this point on that. No matter what kind of plan you have today, if you have a pre-existing condition, under our bill, you cannot be denied coverage, and you cannot be charged more than anybody else. Those are provisions in our bill. Those can't even be waived by a governor if a governor wants more flexibility. But it's a good bill that focuses on low-end costs. And look, Obamacare is failing. We're seeing even more examples. Maryland, some counties are going to be facing over 50% increases. Iowa's complete market has collapsed. This law is not working. The bill we passed over to the Senate is a really good bill, and I hope they can make it better, because putting that coalition together is complicated. It was complicated in the House, but the House came together because we wanted to fulfill that promise we made to the American people, and we did.
Talk to us specifically about the pre-existing conditions issue. Obviously, the Senate filled with moderates. What are the changes that you made, do you think, that will appeal to the moderates in the Senate?
There were two things that were added along the way to specifically put more money into the areas for people with pre-existing conditions so their premiums can come down. Because, look, Obamacare says you can't be charged more if you have a pre-existing condition. The problem is the costs are too high for everybody. And the real story for people with pre-existing conditions in Obamacare are the deductibles. If you're paying a $12,000 deductible, that really almost impedes your ability to use health care, because everything you do, you're paying out of pocket even though you have expensive insurance. In our bill, we actually put $8 billion in. That was the final change we made to the bill, specifically focused on people that just got out of the insurance marketplace altogether but have a pre-existing condition and want to get back in and want to buy at normal competitive rates like everybody else. We put specific money to help them get back in the insurance marketplace at affordable rates so that everybody's premiums can be lower.
So how different do you think this bill looks once it gets through the Senate?
That's going to be up to the Senate. I think what they'll find is I've heard a lot of really good ideas by different senators. There were some really good ideas that House members had that, number one, didn't fit the definition of budget reconciliation, like buying insurance across state lines. We want to do that too, but that would have made this a 60-vote bill in the Senate as opposed to a 51-vote bill. So I'd encourage the Senate to add as many things as they can. But the main thing they're going to find, too, is that anytime you add something on one end, maybe to please moderates, then some of the more conservative members might not like that. So you have to find the balance. You have to thread the needle. And we did that. It was delicate. But all of our members got involved in figuring that out. I hope they do the same. But our focus was always on lowering premiums and putting families back in charge of their health care. As long as the Senate follows that template, and they've got to figure out a way to put those things together and get 51 votes in the process, then we'll be fine. And let's get a bill on President Trump's desk to provide relief for families across the country who are struggling.
There is some skepticism around the Senate right now because perhaps they get overloaded. You've got a health care bill right now headed to the Senate. Then you want to hope to see tax reform soon after. Is it too much? Do you think you can still stick to this timeline of getting these two major pieces of legislation done this year?
We set an aggressive agenda because President Trump wants to get big things done. And frankly, I think he's shown and proven in his actions already that he's pushing hard to follow through on the promises he made. And there are already a lot of really good results. I mean, of course, Neil Gorsuch is on the Supreme Court. The Keystone Pipeline's green-lighted. We've gotten the president 28 different bills onto his desk that he's already signed into law to create jobs and to reduce tax burdens for families. But this is a key part, Obamacare repeal and replace, and tax reform. We can walk and chew gum at the same time. We're working on tax reform. The Senate is going to, of course, be taking up the health care bill, but we're going to be doing all of them in conjunction. And hopefully by the end of this year, if you've got both of those things in place, you're going to see the economy take off like we haven't seen in decades. You're going to see jobs being created and a middle class being rebuilt in ways that we haven't seen in a long time. And it's a good thing that, that we're pushing this agenda hard, because families want this. This is what we campaign on, and this is what Donald Trump and our majorities were elected on.
No, this is what people voted for sure. Let me ask you, because these two major pieces of legislation, health care reform, tax reform, are being done during reconciliation, where you can get 51 votes versus 60 votes. How tough has it been for you to come up with these plans with zero participation from the Democrats?
We reached out early to Democrats, and they made it clear they didn't want to do anything that unraveled Obamacare. And that's unfortunate, because, again, you're seeing Obamacare collapse all across the country. But I guess they're more concerned about having that legacy item for Barack Obama, as opposed to a law that actually works for families across the country. So we said, okay, well, we'll use the budget reconciliation process, because it allows us to do it with 51 votes versus 60. So in the end, with tax reform, we're going to do the same thing. But if they want to play all the old class warfare games and try to pit one group of Americans against another, we're just not going to do that. Donald Trump doesn't want to do that. He wants to unite people, and he wants to actually lower tax rates for all people across America. And look, our plan actually is so simplified, you literally will be able to put your tax returns on a postcard. Over 90% of families in America under our plan will be able to do their own tax returns on a postcard. That's something that's real refreshing in terms of a reform to Washington and the old way of doing things that people have been hungry for a long time.
Yeah, I mean, certainly transparency is one thing that everybody agrees on, but there are some debates as well going on. Does it need to be revenue neutral, the tax reform package? Do you need to keep some of those deductions that are so important to different pockets of the country? What are the debates going on right now around tax reform, and is there more common ground around tax reform than there was with health care? Because, somebody might say, look, why should I believe that you're going to get tax reform done watching the massive fight and delay around the repeal and replace?
Yeah, well, Maria, as we've seen, nothing important and big that the country really wants us to do is easy, but it's necessary. We said with health care, failure is not an option. And I think the same way with tax reform. There's a reason that you haven't had a major overhaul of our tax code since 1986. It's complicated to do, but Kevin Brady, the chairman of the Ways and Means Committee, and his entire committee have been working hard for months on this. They didn't just wait until health care got passed out of the House. They've literally been working for months to try to figure out the best way to do it, working now with the White House. And all of those questions you raised will be answered through the committee, but the main focus is on growing the economy, creating jobs, and look, getting people back to work that have been struggling under an economy that's been growing at less than 2% over the last 8 years. That's unacceptable.
Yeah.
We can do better. We will do better with this pro-growth tax plan that simplifies the code.
No, we just saw the GDP up 0.7% for the first quarter. Not good. Congressman, good to see you. Thanks so much for joining us this morning.
Great being back, Marie.